Good morning.
I know. Good morning. Good morning,
Good
Kyle.
morning. How you doing?
Good.
Hey.
Kyle, I have a very important question for you. What is your coffee order?
Actually, just a Starbucks black. I'm not picky,
I
just
love that.
Starbucks black.
I would
Yep.
have guessed that. What would you have guessed?
I think same.
Yeah. Yeah.
I
Just
think
just
same.
just low maintenance, easy.
Yep.
I was worried for a second, Kyle, that you were going to say you don't drink coffee. And I don't trust people who don't drink coffee.
I, I
Yeah.
probably drink too much coffee.
I
Way too much coffee.
same.
I've
I like
learned
to
to
get
have to
right
cut
into
myself
work.
off about 2 o'clock in the afternoon.
That's-
Otherwise, I don't sleep.
That's exactly right. All day until 2.
We call it being on the beans.
On the beans.
Yes, that's right.
Exactly right. We're always at our best when we're on the beans.
It's true.
Yeah, that's right. Well, you guys, y'all are in for a treat today because we are joined by the president and CEO of Carteret Health Care, Kyle Marek. So I know we're so tickled, Kyle, because look, we all know that there have been so many changes that have been happening at the hospital. I feel like that just the level of care that is offered here in Carteret County has it's just leaps and bounds beyond what it was just a handful of years ago. And so we can't wait to learn more about what's in store. But before we talk about that, Kyle, can you give us a little bit of information about your background? Because you've held this position. I know, I think you were an interim, maybe starting 2 years ago, a couple years ago, and then have officially taken on this role relatively recently. So what has the trajectory been to get you to this place?
So actually, I've been with Carteret Healthcare a little over 25 years. I started here as in the IT department, kind of worked my way up into CIO, Chief Information Officer, and then a VP of Support Services along with that. And then last year, actually December 20th of last year, I got put as interim CEO. And then this past April, they made that an official.
Amazing.
That is
It's
so
been
cool.
It's been a fun ride. Again, I'm biased. Love the organization, so I'm a little biased from that standpoint.
But I mean, but how incredible to hear you say that you love this organization that you've been a part of and that you've worked your way up through. And imagine the perspective that you have on each little nook and cranny of, of what goes on there. Because, you didn't just come in from the outside and you're trying to figure it out.
That, and a lot of people here will tell you that's good and bad.
I am sure. I am sure. Well, listen, I'm sure you're well aware of this, but from our perspective, all we ever hear about you and your leadership is just absolutely stellar things. So we're grateful that you're here and that you're at the helm.
Well, good. Thank you. It's a great group of people here.
Amazing.
Love that.
We've heard. So, Kyle, we want to hear about some of the new things on the horizon. We know a lot of things are already underway with some new initiatives that you guys are carrying out at the hospital. So, can you fill us in?
I can. So as you can see, with the current progress, there's a new parking lot that's been added, and we are starting construction on a new radiation oncology unit.
Amazing.
Our current unit only has one linear accelerator, and this new building, it will be a 2-story building, will house 2 linear accelerators and a CT simulator. So it will be its own about 20,000 square feet radiation oncology unit.
Amazing.
On that second floor, because we're going to be doing renovations once this building's done on the interior part of the hospital to increase medical oncology. All of our conference rooms where you currently walk in there in the first floor are going to be on the second floor. So we're going to have 5 new conference rooms up on the second floor of the radiation oncology building.
Amazing.
And once that's all completed, we will start renovations of medical oncology to increase our capability for infusion bays and providers to have more space for providers.
Sure.
So Cal, from the standpoint of someone with no medical background, right, who doesn't understand this, I mean, help us understand, what is your vision for the organization? What is your vision for the hospital? What can we expect as folks who live in Carteret County and rely on and engage with you guys for our healthcare?
For us to provide high quality healthcare, I mean, that's our goal, is to continue to provide what we can to the community, being the only healthcare provider, from a hospital standpoint, from within a pretty much 45-mile range. So to be able to provide all the basic and necessary services we can within reason. We do have a lot of partnerships, as with Carolina East and stuff like that. They provide the doctors in our for cardiology in our cath lab. And we also have the relationship with Mayo Clinic. So
That's right.
which is really powerful.
Absolutely. Absolutely. So this is so exciting to hear about the expansion of the, cancer care that you can provide right here in Carteret County. Is there anything additional that's new coming up on the horizon for 2024 that you can tell us a secret about?
Well, no, that's most of it. Hopefully we will have a new medical oncologist joining us. Hopefully, we
Nice.
are in conversations with that individual right now. So to
Amazing.
bring to help Dr. James Loins. So
Nice.
That's
we're
really
hoping
exciting.
more, and hopefully to see more and more recruitment from a provider standpoint into the area. We do have a lot of primary care providers that are starting this June, both with Carteret Medical Group, which is our practice, and some of the other practices. So
Okay.
Amazing.
That's
more
really
primary
exciting.
care. Yeah.
You know, it feels to me like that the reputation of the hospital and of the healthcare that you can receive here locally, again, has just continued to become just really, really strong. And so is this, some of this, you've got these really high quality doctors and providers that you guys are employing. And then is this to create facilities that rise to that level? I mean, so that
That's
then
right.
you've got kind of, okay, so you've got the providers and you're continuing to hire them, but now you're going to have this really world-class facility also for radiation and oncology.
That's right. Yep. Then to healthcare and child, education is what kind of draws people to the area, and
Sure.
we're getting up to that. So
That's really
Amazing.
exciting.
This is
Okay.
really exciting.
I know. And so I'm sure, sidebar, that you guys are going to have a capital campaign in order to fund this fabulous new center. So I guess we'll say to folks, if that is a part of your charitable giving, if you want to contribute to this incredible healthcare opportunity here in Carteret County, then I'm sure we can get you, or you can find, we'd be happy to share with you any links that we have about how you can learn more and contribute financially. And then for folks otherwise, just for them to understand, I mean, I think that's so important for them to understand the level of care that's right here in Carteret County.
that's right. Yeah, that is huge. That's what we want everybody to know, the high quality healthcare we provide for the community.
Okay. Is there anything else that you want to make sure people understand about what's happening at the hospital?
That's all I can think of that's kind of really big. I mean, this is going to
Just
be
a small project.
I mean,
it's just
exactly.
right now we're estimating about $50 million project. So it's going to be, and it's going to take a little over 2 years. So
Amazing.
be a lot going on.
Sure.
That's exactly right. That's
Well-
right. And I'm sure for folks who've seen the construction, seen the preparations that are happening over at the hospital, this is great for them to understand what's happening and what the end result's going to be, which is really exciting.
And thank you for investing in our community. I mean, that's a huge addition to our community that I know everyone is excited about, because everyone in some way will be impacted by it. So amazing.
Right.
So Kyle, we have a final question for you before we let you go, because we know you're
Okay.
really busy. Construction right outside your window.
Yeah.
Mary Cheatham, will you ask Kyle our final question?
Kyle, what is saving your life right now?
I'd have to say my team. Honestly, that's kind of what makes me successful, makes the organization successful. My team here, but my home team. So
Oh, I love
Oh,
that.
I love that.
Kyle, we have, I haven't had the pleasure to meet you in person yet, but we've heard from several people, even outside of your organization, how strong of a team you've built and how well you guys work together. And I think that is such almost probably the biggest compliment, I think, that a leader in, your position, Mary Cheatham as well. I mean, I think that's so cool that people even outside of the hospital are saying that. So
that's good.
congratulations.
Makes me feel good. It
I was
is a
going to
great.
say, yeah,
Yep.
a lot to be proud of. And look, and
Absolutely.
I'm sure that your humility and it's so refreshing to see. We're just grateful to have you here, bringing us all this great news, and so proud of the team that you've assembled. So thank
Well,
you for
thank
all
you.
you do.
No, we appreciate it. Thank you.
Awesome. Bye, Kyle. Have a
Thanks,
good weekend.
Kyle.
Bye. Have a good one.
Bye.
Man, that is so cool.
That's really cool.
Seriously, I continue to hear people say, oh my gosh, what
Yeah.
he's doing and what that team of folks is doing is really incredible.
People within the hospital and people outside of the hospital. I think that's such an indicator of who you are as a leader. If people can recognize that when they're not even on your team.
That's
that makes
exactly right. That's exactly right. And I think, I don't know what you're hearing, but I mean, for me, I think one of the things that's really cool, especially doing what we do and helping folks move here,
Mhm.
and is I think more and more people who used to would have traveled somewhere else for care for things,
Right.
especially for illnesses and that type of thing, acute things. I feel that they're now staying here
Mhm.
because the care that we offer in the facilities that Carteret County has continued to just be so amazing.
Agree. It's like a comforting feeling in a way.
It is a comforting
Because
feeling.
it's something you don't think you're gonna, you don't think something will happen to you where you'll need to go to the hospital or need extra care or something like that. But you all know that accidents happen, things happen, people will need some extra care as well. So
Yeah.
it's a comfort to know that that's right here. Literally, we could throw a rock and hit the hospital.
Yeah,
I mean, it's
which
so
is really cool.
close.
I also I think that COVID has given us all a whole new appreciation of that.
Oh yeah,
You know, I mean, think
Big
about what a
time.
mindset shift that is, the way we feel about
yeah,
our local hospitals.
agree.
Yeah, that's a big deal. Well,
It is.
really, really a good one.
It is.
I loved hearing all that. Well, Meg, what's saving your life?
That's an excellent question. January is over. Well, almost. January is
Mhm,
almost over.
mhm.
Which I always feel that January moves very slowly. So I kind of love that after the chaos and the quick movement of the holidays.
Mhm.
I don't know about you, and I know it's been a month, but the holidays this year seemed to be so fast paced.
I know.
Like I blinked
I
and
know.
they were
A
they were
whirl.
done.
I know.
And on the work front, personal for everything was just busy, which is great and it's all positive. And January was lovely to just kind of slow down a little bit.
Yeah. Yeah. I think that that's right. I think what I'm grateful for is, we all plan kind of for the new year and figure out exactly what we want it to look like. And I feel grateful that we're in it and that we're doing the things that we promised to ourselves and to other folks that we were going to do. And no, I mean, it's not perfect, certainly,
Right.
but just that we're all moving forward with our plan. And I don't know, starting a new year, I always feel a little bit nervous,
Mhm.
but it feels good now to be settled and on the right path.
It's an excited nervous.
That's exactly right. It's exactly right. So that's good. Well, you guys, thank you for joining us. Happy Friday.
Bye guys.
Bye.